Gastroschisis versus Omphalocele. So we'll be looking at some important characteristic findings of both and differentiating them. So to start off with a few questions. First one being, how is the umbilical cord in both of them, that is gastroschisis as well as the Omphalocele. Next is, how is the malrotation? Is there malrotation in case of both? Next, in case of the enteral nutrition, what is the status of the enteral nutrition? So we'll find out these answers and a lot more in this video. So going first, in case of gastroschisis, we are looking at the defect size now. So defect size, and this is nothing but in case of diameters. So in case of gastroschisis, it is about 2 to 3 centimeters, and in case of Omphalocele, it is about 2 to 15 centimeters. Next, we move on to the sac. So in case of sac, the gastroschisis, it is there is no, and in case of Omphalocele, it is always there. That is, it may be ruptured as well. It is ruptured. Next, we are looking at the gestational age. So gestational age in case of gastroschisis, it is nothing but the pre-maturity. And in case of Omphalocele, it is the term. Then we look at the umbilical cord. The umbilical cord, it is nothing but it is adjacent. It is adjacent to the defect. That is, the defect is usually on its right side. Now, looking at the Omphalocele. In case of Omphalocele, it is attached to the sac. It is attached. Next, we are looking at the herniated viscera. So in terms of the herniated viscera, the gastroschisis, it is small bowel, stomach, and the colon. Then in case of the Omphalocele, it is the small bowel, stomach, the colon, and the liver. Next, we look at the malrotation. So in terms of malrotation, it is present in both. That is, yes, in case of the gastroschisis, as well as yes, in case of the Omphalocele. Omphalocele is also a yes. Then we move on to the bowel character. So what is the bowel character? The bowel character, it involves, it is inflammatory as well as edematous. This is in case of the gastroschisis, and in case of the Omphalocele, it is normal. Then we move on to the enteral nutrition. So enteral nutrition, if you see, in case of the gastroschisis, it is delayed, whereas in case of Omphalocele, it is normal. Then looking at the associated abnormalities. So associated abnormalities in case of the gastroschisis, it is uncommon. That is, you can tell about 10% atresia is seen. Next, in case of the Omphalocele, there it is common. So this is about 50%. Now moving on to answer our questions. So the first question we asked was, what is the status of the umbilical cord? So the umbilical cord in case of the gastroschisis. So gastroschisis, it is nothing but it is adjacent. It is adjacent to the defect. And the defect is usually seen on which side? It is seen on the right side. Next, we look at the Omphalocele. So in case of Omphalocele, the umbilical cord is nothing but it is attached to what? It's attached to the sac. Then what is the status of malrotation? So in case of malrotation, it is yes, malrotation is present in case of the gastroschisis. And what about the Omphalocele? So the Omphalocele, yes, the Omphalocele also has presence of the malrotation. Then we move on to the enteral nutrition. So this was the next question. The third question we asked was, what is the status of enteral nutrition in case of the gastroschisis and the Omphalocele? So here, in case of gastroschisis, it is delayed. Then moving on to the gastroschisis, it was delayed, and in the Omphalocele, it is nothing but there is normal. The enteral nutrition is normal. Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.